with a series of congenital left ventricular inflow obstructions. And congenital left ventricular inflow obstructions are very uncommon situations, and you can have, starting from the pulmonary vein, pulmonary venous obstruction called right atrium, or supravalvular rings or intravalvular rings. Then you can have an obstruction at the annulus, valvular, that could be intramitral ring. You can have a subvalvular problems like parachute valve, arcade, or hammock mitral valve. So let me today take you and show you a case of pulmonary venous stenosis. Pulmonary venous stenosis, you can have stenosis of the origin, the insertion of the pulmonary vein, either one or multiple pulmonary veins. The next could be a right atrium, where you can have an obstruction or a membrane just below the insertion of the pulmonary vein and above the left atrial appendage. Now, if it is below the left atrial appendage and it's a level of the mitral annulus, then it's a supravalvular ring. If it is inside the mitral leaflets, then it's called intramitral ring. And in case it's below the mitral valve involving the apparatus, which is the commonest kind of congenital mitral valve, then you have these varieties. The pulmonary venous stenosis, that's what I'm going to show you a case about. This is a young male which presented with the heart failure features, and you can see there is a large secundum ASD with absolutely good margins. And here you see there is an elysing at 77 centimeter per second neck width limit. That means these are very high velocities coming from the left pulmonary vein and the right pulmonary vein. So these are the indicators of stenosis of pulmonary vein insertion. And that's the flow pattern, which is kind of a continuous flow and a high velocity more than 1.2 centimeter, indicative that this is a case of a pulmonary venous stenosis. And then we shifted to a suprasternal view, what we call as a crab view, where you can see all the four pulmonary veins together. What do we do here? We are in the suprasternal view. When our marker is facing towards the left shoulder, we rotate it anti-clockwise so that it faces the chin. And then you see this view. This is when the aorta is in the cross section. You see superior vena cava along with, and many a time you see a pulmonary artery here. Then what you see, a pulmonary vein. In all four pulmonary veins, what we call as a crab's view, 1, 2, 3 and 4 pulmonary veins. This is called a crab's view, and this is left atrium. Now in the crab's view, what you can see here is that you see this is one pulmonary vein, that's another pulmonary vein, this is the third pulmonary vein, and this is again the left upper pulmonary vein. Then these left lower and right pulmonary veins are all showing increased flow velocities, indicating of a pulmonary stenosis. Again, you see elysing in the left lower pulmonary vein in a modified crab's view. So this is what I showed you about crab's view. Next, I would show you about other causes of obstruction in the LV inflow in a congenital format. Oh, good idea. Please keep subscribing, and whenever I post the new video, you would be notified immediately. Bye till then, and happy learning. Hi friends, let me share with you a series of LV inflow obstruction as a congenital cause. I think it's a good idea to subscribe so that whenever I post something new, you would be notified and you'll be probably the first people